Diabetes. Diabetes is something that everybody hears about, many people joke about, and many others are afraid of. But it is a very commonly misunderstood disease. Often when people hear diabetes, they think obesity, sugar, junk food. However, those three things are far from an explanation of what diabetes truly is. Diabetes relates to the endocrine system in the body, which is responsible for managing and regulating hormones for everyday life. Specifically, diabetes relates to the secretion, their lack of two main hormones, insulin and glucagon, which are released by the pancreas in a self-regulating system, also known as a negative feedback loop. These hormones are responsible for regulating blood glucose levels, which is the concentration of glucose in the blood, and are crucial for the breakdown of fat, carbohydrates, and proteins. In this negative feedback loop, there are two main stimulants, an increase in blood glucose levels and a decrease in blood glucose levels. First, let's focus on the increase in blood glucose levels. Human ingests sugar, their blood sugar levels begin to rise. When the body recognizes an excess amount of sugar in the blood, the insulin-secreting cells in the pancreas are activated, releasing insulin into the blood, which serves two main purposes. Insulin helps tissue and body cells engulf the sugar from the blood for energy, while the liver also takes up the excess sugar to store as glycogen. Once these processes occur, the blood glucose levels in the blood return to a normal level, which is around 70 to 120 milligrams per deciliter. Now, there are also dips in blood sugar levels, usually due to skipping a meal or lots of exercise, which activates the glucagon releasing cells of the pancreas to release the hormone glucagon. Glucagon makes its way to the liver to be converted back into the glucose to rise blood glucose levels back to normal. This cycle happens involuntarily for those who do not have diabetes. In a more molecular viewpoint, when a person without diabetes digests carbohydrates, another name for sugar, those sugars get broken down into smaller sugars called glucose, which gets absorbed into the bloodstream. In the body, glucose is then absorbed by body cells to be used as energy. This process is ideal for all humans, but unfortunately, diabetics do not get the luxury of a properly working pancreas, and therefore do not have this. Diabetes comes in three flavors, so to speak: type 1, type 2, and gestational. Type 2 diabetes, while genetics can play a role in the susceptibility, poor diet and exercise are the primary cause. On the contrary, type 1 diabetes and gestational diabetes are unavoidable. Gestational diabetes is caused by hormones secreted by the placenta during pregnancy, and although the cause cannot be narrowed down to just one factor, type 1 diabetes is said to be caused by genetic inheritance or exposure to different environmental factors such as a virus. Although many people believe that a type 1 diabetic and a type 2 diabetic can both alleviate their symptoms and even eliminate the disease as a whole through good diet and exercise, that is not the case. People with type 2 diabetes can get rid of the disease with a healthy lifestyle, but those with type 1 diabetes will have this chronic illness for their entire life. In the next 32 minutes, we will shine a spotlight on this very commonly misunderstood chronic disease and its effects on the lives of everyday people managing it, and the community that it creates around them as a result. This is type 1 diabetes. First, we're going to focus on the physical symptoms and issues that are caused by having this disease. It is important to recognize that these physical conditions and problems that can occur in response to diabetes are due to the highs and lows of one's blood glucose levels. In hypoglycemic moments, meaning the blood sugar drops to concerningly low amounts, the body reacts with symptoms that would be explained by an endocrinologist.
When your sugar goes low, you can feel a little flaky or spacey, your legs can feel like jelly, you might get a headache, which are all annoying things, but not life-threatening things. If your sugar goes too low, your brain starts to feel the effect of glucose deprivation, and you start getting confused, fuzzy-headed, sleepy, comatose, etc.
These symptoms, as explained by Dr. Liber, an endocrinologist, can be alleviated with sugary foods or in extreme cases a glucagon injection. In hyperglycemic moments, when blood sugars rise too high, the person feels similar symptoms, but Dr. Liber will explain some other symptoms that they do feel as well.
The person becomes thirsty and urinates a lot and wants to eat a lot, and in spite of that loses weight. Sometimes there's stomach aches or headaches or visual changes, but more often than not it's the thirstiness and increased urination and weight loss.
To alleviate hyperglycemic moments, the diabetic uses insulin and water to try to reduce their blood sugar. We will begin our exploration of how type 1 diabetes affects one's entire body by starting at the bottom, with the feet. Poor blood sugar management can cause a multitude of nerve and circulation issues in the feet due to its proximity from the core and susceptibility for injury. We will now hear from Dr. Sultana, a podiatrist who will explain how blood glucose levels directly impact the feet with specific conditions.
So diabetic neuropathy is basically a loss of sensation, and this loss of sensation occurs because of uncontrolled blood sugar that leads to damage to the nerves and causes pain, numbness and tingling sensation, and burning sensation to the feet. Patients with diabetic neuropathy also has a loss of muscle function to their foot, so they are unable to feel certain areas, which has increased pressure leading to ulcers.
Another main issue that occurs in diabetics is peripheral vascular disease.
So peripheral vascular disease is actually a decreased blood flow to the lower extremity. It occurs because of an increase in plaques in the arteries of the lower extremity. The symptoms that patients feel are intermittent claudication, which is difficulty when walking, pain with rest. Patients may have swelling to both feet, cold temperature or coolness to bilateral lower extremity, and a loss of hair or absent hair on both feet. Peripheral vascular disease can lead to complications such as gangrene and ulcerations. When patients are diagnosed with peripheral vascular disease, because we're the first to see it in their feet, we send them to a vascular specialist for further evaluation.
The next area that we will focus on is the reproductive system and how the influx of hormones at certain stages of life affect diabetics differently than people living without diabetes. During earlier years of a diabetic's life, the management of blood sugar can be incredibly difficult with the constant fluctuations in hormones during puberty. Estrogen and testosterone, both being hormones secreted during puberty, directly cause an increase of blood sugar. These hormones also cause insulin resistance, which is where the body is less receptive to insulin. For girls, going through puberty in particular will cause very drastic highs and lows of their blood sugar before, during, and after their period. Later in life, if a woman with type 1 diabetes becomes pregnant, their management of the disease is even more crucial in the 9 months leading up to the birth of the baby. If women do not take their blood sugar regulation seriously during pregnancy, their baby can be born with severe birth defects to the brain, spine, heart, lungs, kidneys, as well as other vital organs. The size of the baby with a diabetic mother are on average much larger than those who do not have a diabetic mother. Therefore, with the larger size, they are more susceptible to shoulder injuries during delivery and even usually result in the need for a C-section, where the baby is not delivered through the birth canal, but instead cut out through the mother's stomach. Another region of the body where type 1 diabetes affects dramatically is the kidneys. Since type 1 diabetes causes small blood vessels in the body to become injured, the kidneys are a place where those small injuries can cause big problems. If the blood vessels in the kidneys become damaged, the kidneys cannot do their job of cleaning the blood. as extensively and efficiently as the body needs them to. This causes the blood to carry more water and salt, which in turn causes weight gain and ankle swelling. Now, we'll look at the heart and the cardiovascular system. High blood sugar causes narrowing of the blood vessels, which leads to a decrease of supply of oxygen and blood for the body. Since high blood sugar causes narrowing of the vessels, and narrowing of the vessels causes high blood pressure, and high blood pressure is the leading cause of heart disease, diabetics are at a great risk of heart disease, as well as heart attack, stroke, and peripheral vascular disease. Although type 1 diabetes does not affect the mouth specifically, food and diet can be one of the most drastic lifestyle alterations that someone has to make after being diagnosed with diabetes. Diet changes such as low sugar, low carb, vegan, as well as gluten-free are all diet changes that many diabetics adopt for sugar regulations. With diets that are adopted by choice, people with diabetes have recognized the spikes in their blood sugars due to these food groups, such as candy, pasta, pizza, and soda, and have altered their diet respectively, avoiding what makes it drastically increase and supplementing those with foods that seem to not have a huge impact. One diet that is forced upon diabetics 10 times more often than the average human is celiac disease. Celiac disease is another autoimmune disease that type 1 diabetics are extremely susceptible to, where the ingestion of gluten, which consists of wheat, rye, and barley, causes damage to the small intestines. This intestinal damage drastically affects the absorption of nutrients and causes extreme abdominal pain, as well as bloating, fatigue, anemia, and weight loss, among many other symptoms as well. As you probably realize by now, type 1 diabetes has the capability of affecting one's body in many different areas. One area that people would commonly overlook is the eyes. There are a multitude of complications that can occur to the eyes due to poor management of blood sugars. The most well-known issue that can develop in diabetics is diabetic retinopathy, where the blood vessels in the retina are severely damaged, which can cause vision loss and even blindness. Some other common eye complications for diabetics include glaucoma, diabetic macular edema, and cataracts. Now, we will hear Dr. Avalon, a practicing ophthalmologist, speak more in depth about diabetic retinopathy.
The elevated glucose levels in the blood damage the cells that maintain the outside or the integrity of the blood vessels inside the eye. And so a short elevated blood sugar really has no impact on those cells, but long-term high blood sugar damages those cells and over time causes the blood vessels to be unstable.
Other common problems that occur in many individuals with diabetes, especially within the older populations, are cataracts, where the clear lens of one's eye becomes blurry and foggy, as well as glaucoma, where the optic nerve is damaged due to pressure, causing blindness. The last aspect of the body that we will explore in relation to type 1 diabetes is the brain. As a child with type 1 diabetes develops, the disease affects the development and growth of the brain, causing memory and attention span to be drastically affected. In hypoglycemic episodes, the brain's memory is significantly decreased, as well as an increase in anxiety and difficulty doing basic, routine tasks. In episodes of hyperglycemia, patients in multiple different studies showed signs of increased emotion, fatigue, and rapid eye movement. As much as type 1 diabetes affects the body from head to toe, it also directly affects a person's everyday life, tasks, and emotions, along with their friends and families. For people diagnosed early in their life, their childhood consisted of their parents checking their blood sugars and giving them insulin shots until they were able to take the reins of managing the disease themselves. These individuals who were diagnosed at ages 1, 2, and 3 do not have any recollection of a life before bloody finger pricks and needles left and right. That is all they know. In the case of Megan Noonan, who was diagnosed at age 4 and is now 32 years old, she did not have much recollection of being diagnosed because she was so young.
So it's like I've been a diabetic my entire life in my mind. I don't know, it might be harder to be 13 and diagnosed.
Similarly, in the case of Hannah Housley, a 13-year-old teen who was diagnosed when she was 4 as well, She also does not necessarily remember life before diabetes, and therefore did not find the transition of being a person without the worries of insulin and needles to an insulin-dependent one very difficult. However, Hannah did point out the responsibility taken on by her whole family.
My parents, of course, have been insanely helpful and supportive because being diagnosed at a young age, you're not really given a choice in what you do, and so it kind of falls onto your parents. And I always joke with my mom and dad, it's like adding a third child to the mix. And then my brother, of course, I have an older brother, and he's also been insanely supportive because adding a third child into the mix takes away a ton of attention from him since, I mean, he's only 5 years older than me, so since he's 5, like, that's like having 2 child's worth of attention on his sister and 1 on him.
For people diagnosed in their early teens or teenage years, their diagnosis is usually followed by strong emotions of anger, frustration, sadness, and anxiety, for it feels as if their whole life is flipped upside down. In the case of Jordan Cox, an 18-year-old girl from Annapolis, Maryland, she was diagnosed at the age of 13 and found that most of her hardships after she got diagnosed had to do with fitting in with her friends and not feeling like an outcast that constantly had to give herself shots.
I remember when I got back to school after my diagnosis and being in the hospital for 5 days, and I remember hearing from some friends, people were asking if I had type 2 diabetes, which I now knew was different than type 1, and so I felt very insecure about my body and about my weight, even though I did lose about 30 pounds in the month prior to being diagnosed with type 1. And I remember carrying my diabetes pack, trying to hide it in my backpack, going to the nurse every day to do my shots. My friends were very supportive though. They were great when I was diagnosed and I came back to school. I would have a group of like 8 to 10 kids just go meet the nurse every day, skipping their recesses and lunches to do my shots with me and just being a great support.
As Jordan just explained, her life was impacted not only with having to prick her finger to test her blood sugar and give herself insulin injection, but the disease also made an impact on her diet, exercise, and everyday life. For people with type 1 diabetes, their world changes when they are diagnosed. They have to be on top of their blood sugars 24/7 by pricking their fingers 4 to 6 times a day, giving themselves multiple insulin injections a day, maintaining a healthy diet, and exercising regularly. And, as Dr. Libra says, there's never a day off.
But it's a chronic illness, and in order to take the best care of yourself, if you happen to have type 1, it's kind of a constant exercise in self-monitoring, remembering to test your blood sugar, remembering to give your insulin at the right time and at the right dose. And it's as a cousin of mine put it, cousin who had type 1, you're never on vacation. I may have brought that up at times, that there is never ever a day off. And even though you can compress all the daily routines into a 10-minute hunk, it's there, and it has to be heeded, paid attention to, because if not, then sugars can climb, and every time the blood sugar spikes, it's not good for your body cells. Glucose is toxic if it's there in high amounts, so we try to help teach kids and their parents to self-monitor, and yet at the same time not be too heavy-handed to instill fear and dread where it doesn't need to be instilled.
Although it is more rare, some people are even diagnosed with type 1 diabetes at older ages like 20, 25, and 40, like some of the people we spoke to. The feelings attached to being diagnosed with this disease later in life were initial feelings of confusion and sometimes embarrassment. In the case of Richie Taylor, who was diagnosed at age 21 when he presented symptoms of mono, he highlighted a struggle about diabetes that many people do not consider: being comfortable around others with regards to a CGM, continuous glucose monitor, and being insulin dependent. Richie found it difficult to return to dating because of the glucose monitors and the insulin injections.
When I started dating again after I got out of this recent relationship, I was nervous about, the CGM, like being attached to me and all that kind of thing. And, you wonder how you breach the subject with new friends and, new significant others or just casual, acquaintance, things like that, because you don't want people to think of you differently, that kind of thing. And, ended up, the ironic part is everyone I ever told, even since that, never been in issues. And maybe I'm just that, it's just worth it for people just to be around me that are willing to deal with it. No.
In cases such as Willa Cook, who was diagnosed at age 44, with her presenting symptoms at a later age, she was initially incorrectly diagnosed with type 2 diabetes.
I was aware of the differences, but I didn't know you could get type 1 as an adult, so they actually mistakenly diagnosed me as type 2. So I went in and they told me to exercise and lose weight, and I looked about this and I was like, how much weight do you want me to lose? I walk every day, I average 13,000 steps, and so they just said to do 15 or 16,000 and lose weight. So I actually lost 8 pounds and down 105 pounds and exercised myself to death before I finally got the correct diagnosis and endocrinologist. So.
Generally speaking, the transition from being someone with a properly working pancreas to an insulin-dependent individual is quite a change not only for the diabetic themselves, but also for their friends and family. For many of those who are diagnosed with type 1 diabetes, their families are very supportive and understanding with the struggle of managing the disease. For those individuals diagnosed at an earlier age, such as Megan and Hannah, the parents have a much greater responsibility for their children.
My mom was like super diabetic mom. She started as the first support group in Annapolis. She was very much an active mother, would come to sleepovers at like midnight to test my blood and then come at 6 a.m. to give me, because I was doing injections at the time, would come and give me my long-acting insulin at 6 in the morning because she wanted me to feel like the average kid. My dad just he was supportive, but my mom took the reins and was very active in being the diabetic mom.
Although Jordan was not extremely young, like Megan and Hannah were when they were diagnosed, she also had a lot of support from her parents.
My parents were also very supportive when I was diagnosed. I remember my dad would make specialized meals for me every night when I came home for the first year or so until I took the reins. My mom would pack my lunches and help me carb count until I got used to the fact that I have to count every single sugar, every single carb in my lunch and breakfast and dinner.
In Richie and Willa's cases, although they were diagnosed at an age where their diabetes management was mainly their responsibility, they still received tons of love and support from their family and friends.
My family was always very, helpful and encouraging, and my mom was initially sad and didn't really understand it, but, she kind of realized that it's very manageable. There are things you could do, and so it was some adjustment. But I think I was lucky to get it later on when I was after college, after I was an adult, didn't have to worry about classes and going to parties and things like that, and I was able to kind of get some good habits. But it's definitely shocking.
One thing I think helps diabetics more than people think and more than a nutritionist or a therapist is the support from their family and their friends and those around them. For me, I have felt for many years alone when it came to type 1 diabetes. But with the support system that I do have with my parents, my brother, my grandma, and my friends at school who know how to take care of someone with type 1, who've been with me for many years, it's been a tremendous help emotionally, mentally, and physically.
However, even with careful blood sugar regulation and amazing support from friends and family, unfortunately, the highs and lows do come and go and are often frightening to go through.
A couple times I've gone out and walked and not been, you know what I mean? Like you realize you're going low and you're like, oh, I'm a mile from home. Like you're kind of out there. So it's like, oh.
I had a lot of, when I was younger, not as much as an adult, but a lot of problems waking up, and I was low, and I just had no memory of even waking up. So my parents would walk me, for one example, my parents walked me to the bathroom because they could tell I was low. They just wanted to sit me on the floor and get me some juice. And my dad let go of my arm, and I just fell face first into the sink and cracked my head open. But no memory of any of this. I don't remember waking up. So it was that kind of thing, like I was getting low in the middle of the night, and I had no idea. This is prior to having a continuous glucose monitor and just crashing. Now I'm a lot better at feeling it come on, just a feeling in my stomach, kind of dizziness, but I was not good at picking up on those signals when I was younger.
Although low blood sugar episodes can be very traumatic experiences to those with type 1 diabetes, another worry diabetics have is constant high blood sugar. The most common method to keeping blood sugars regulated and below 120 is through a healthy, balanced diet. There is not one universal diet that people need to follow with diabetes, but through trial and error, diabetics find what works specifically for their bodies to maintain healthy blood sugars.
Because I was diagnosed with type 2, I changed my diet and exercise, and then I kind of kept it. So, because I haven't destroyed all my cells, I'm actually trying to hold on by eating gluten-free. So I only have to take 1 shot of insulin. I take 1 shot of basal insulin. It's a little bit high, so I take 1 shot a day, and it covers my food. But that's because I eat less than 30 grams of carbs a day, and I eat no grain and pretty much no fruit. Every once in a while, I'll have like strawberry or something, and then I eat like low carb, high fat. So it's a big adjustment.
So after my diagnosis, 9 months later, I was diagnosed with celiac disease, which is a gluten allergy to wheat, rye, and barley, if you don't know what gluten is. And so that is one way that my diet is altered, not because I wanted it to, but I think going gluten-free has definitely helped me with my diet tremendously, just feeling less bloated and better about my body. And it's helped me kind of transfer to a lower carb diet as well, trying to avoid pastas, which were one of my favorite things. I don't like to do gluten-free pastas as much since it is such a high carb food. But there are so many gluten-free options nowadays, it doesn't even really matter. I try and stay low carb when it comes around to dinner time, because when I do fall asleep, my blood sugars tend to climb a little bit, and I try and keep as low carb as possible throughout the day. There are those times, though, I need the carbohydrates.
Although healthy diets, exercise, continuous glucose monitors, and insulin pumps make the lives of diabetics much easier when it comes to maintaining good blood sugars, those with the disease will still have to manage type 1 diabetes for the rest of their lives. With new developing technologies on their way and new forms of research, however, even a cure for type 1 diabetes is possible. Individuals with and without diabetes all have their own hopes for the future, whether it be a cure, more research, new technologies, or just more affordable diabetes supplies. And here's what our interviewees hoped for.
That's my hope for the future, is that there will be a cure. That I won't have to live in fear of going blind or having a heart attack in my sleep and not waking up to see my kids, or all of the other things that scare me a lot. It's scary.
My biggest hope for the future of diabetes, obviously a cure, and I know there's a lot of research going on right now about that. One of those is stem cell transplants with the beta cells into the pancreas. Another way that I think type 1 can be cured in the future is through the BCG vaccine for tuberculosis. I've seen a lot of news around that, how 2 type 1 diabetics, I think, were cured of diabetes. They're still in their second phase of trials, I think. But I definitely think, if not a cure, more technologies to help diabetics manage their blood sugar through their CGMs, which I have, and their pumps, making a pretty much external closed loop where your CGM checks your blood sugar, tells your pump to give you the insulin that you need, and it continues on to that cycle, which makes life much easier to handle for type 1 diabetics.
I would like to see it, like the insulins and all that, become more affordable, because I feel like based on, how long it's been around and all the evidence and things like that, that definitely there's probably some price gouging and things in there. People shouldn't have to be able to worry about, if they can afford their insulins, which make them, which could, it's not like it's it's bad enough. There's so many disorders out there. Some are rare, some are, more common, but, type 1 diabetes has got to be one of the most common diseases out there. And the treatment's very straightforward, and they've been around forever, yet, people are having issues with affordability and things like that. So it would be nice if, that could get solved a bit and just make it a little bit easier for people.
The ideal for us endocrinologists and for patients and families is to have a closed loop system, or a pancreatic transplant that is safe and long-lasting. And we're almost there with the first part, with a closed loop system. There's now a hybrid closed loop that has just come into being, that partially doses insulin without necessarily patient input. But it's not fully there yet. But in the next year, 2 or 3, I'm hoping it will be. And that will take a lot of the daily stress out of management.
If you would like to learn more about how we created this documentary and our process step by step, please visit the site severnfellow19coxpribble.weebly.com.